So hello everyone, my name is AR and today I'm going to be discussing about employment and travels for pregnant women. Let's go. So the first that I will discuss is about the employment. So because of the public assistance laws, many women are working during pregnancy than ever before. Unless the job involves exposure to toxic substances, lifting heavy objects, other kinds of excessive physical strain, long periods of standing or sitting, and maintaining body balance. So there are few reasons why women cannot continue working throughout pregnancy. So unless they work for a company with fewer than 15 employees, there is a federal law that would protect women from not continue working. They are protected by the loss of employment benefits. So according to the federal law, an employer cannot deprive women of seniority rights in pay or promotion because they take maternity leave. They cannot also treat women returning from maternity as new hires. Also force pregnant women to leave their job if they are able to and want to continue working. Fourth one is to refuse to hire women just because they are pregnant. Next one is refuse to cover employees' normal pregnancy and birth expenses in the company health plan. And the last one is to refuse to pay sick leave or disability benefits to women whose difficulty pregnancies keep them off the job. So in 1993, the Family and Medical Leave Act is passed. This is another federal law that guarantees women all the rights she's guaranteed of, like the right of 12 weeks of unpaid, the job protected leave on the birth of the child, the adoption of or foster placement of a child, and so many more. So most of the women in the family are not aware that they can take time off from work during pregnancy or spend time with a new baby. In addition, women may be able to qualify for provisions under the Americans with Disability Act or the ADA. So there are some occupations that can be hazardous during pregnancy. It is because there are works that has harmful substances. An example of this is nurses working with anesthetic in operating rooms. Also, nurses working with chemotherapy agents can also be a risk. Most women work to augment or supply family income, but not for fun. Even those who could afford to leave their jobs may not be willing to sacrifice the collegial relationships. So now I'm gonna be discussing about the travel. So because we live in such mobile society, many women have questions about travel during pregnancy. So during the early stage of normal pregnancy, there are no restrictions unless the woman needs to travel to a malaria-prone or Zika virus or other risk region where she would need vaccine protection. If a woman is susceptible to motion sickness, tell her not to take any medication that is not prescribed or approved by the healthcare provider. So you can advise her to use a seasick, wrist, or acupuncture band for this. So take note that in the last stage of pregnancy, travel plans should take into consideration the possibility of early labor, requiring birth at a strange setting where a woman's obstetric history will be unknown. So regardless of the amount of her pregnancy, if a woman plans to spend time at a remote area or a woman taking a family vacation at a campsite, she should investigate first the nearest healthcare facility for an unexpected complication occurrence. So tell her not to eat unwashed fruits or vegetables or raw meats and waters that are not purified. And also she should also consult her doctor for her records to be copied and carried by her or with her consent. When a pregnant woman is also taking a long trip by automobile, advise to her to have a frequent rest or stretch periods, preferably every hour, but at least every 2 hours. She should get out of the car and walk for a short distance. So these stopovers relieve stiffness and muscle aches and improves lower extremity circulation, and also helping in preventing varicosities, hemorrhoids, and thrombophlebitis. So the pregnant woman may drive automobiles, but they should also make sure that they fit comfortably behind the steering wheel, and the seatbelts is also a must when driving like everyone else. Pregnancy is also the time for the family to think about the transportation safety of the newborn. Purchasing a car seat is an investment that not only in legally required for transporting infants but also helps guarantee their safety. So traveling by plane for women is not contraindicated during pregnancy as long as the plane has a well-pressurized cabin. So there are also airlines that do not permit women who are more than 7 months pregnant to board. Others require written permission from their healthcare provider. So those women who travel abroad or need additional safety measures, such as vaccine for protection against cholera or antibiotic prophylaxis for malaria before they can safely enter certain countries. But before allowing or accepting any immunization, a woman should ask first her healthcare provider to verify if it is safe for her. All contraindicated during pregnancy and should not be administered unless the risk of the disease outweighs the risk of pregnancy, because live virus vaccines can cross the placenta and infect the fetus. So that's all for employment and travel discussions. Thank you for listening, and bye-bye.